Penis is the most treasured body part in males. It is made up of glands, head and foreskin. Foreskin slides freely over the penis. If it is tight, then the condition is known as phimosis.
Hi, we were looking at the parts of the penis. So I want to tell you about a condition known as phimosis. Phimosis basically means a tight foreskin. So the male is not able to retract the foreskin over the penis. Now this can happen right from birth, meaning like children can also have this condition, but usually the foreskin kind of separates at about 6 to 8 years of age. But this condition can also occur in adults. So one of the reasons is congenital, meaning from childhood itself the foreskin may not separate. Secondly, adults might develop an infection. The most common infection is a yeast infection, which will occur in diabetics. If this happens also, then this condition known as phimosis develops. In this condition, the adult cannot pull the foreskin behind the glans of the penis.
Step 1. Take hot water bath. Applying moisturizing cream on head of penis. Regular stretching. Foreskin stretching exercises can help phimosis in early stages. Gently pull foreskin back till the point of pain. Practice this for 8 weeks. If foreskin is still tight, then the next best solution is circumcision. Circumcision is surgically removing the foreskin and exposing the head of the penis, called the glans penis. Dates back to the prehistoric ages, indicated as rituals in some religions. Whether foreskin is cut or uncut, what matters here is how it feels when having intercourse.
Circumcision is a procedure that involves removal of the foreskin. We've already explained to you about what phimosis is and why it occurs. Now we've also advocated foreskin stretching exercises. If these exercises don't work even after about 6 to 8 weeks, and if you do have problems, now in children it could be recurrent urinary tract infections. In adults it could also be recurrent urinary tract infections, it could be painful intercourse, or it could be just infection of the foreskin or the head of the penis. Now this is known as fasciitis. So if you have all these problems, then the only treatment for this available is the removal of the foreskin. Now this procedure is known as circumcision.
According to some research, circumcision is originated from Egypt, where it's performed to reduce masturbation rates, which is believed to have caused mental and physical illness among Egyptians. Another study came out against it, claiming that there is no clear medical benefit and risk for severe blood loss. Death rate and infection is high. This led to decline in circumcision of men. In worldwide, only 33% of men are estimated to be circumcised. When you study sexual pleasure and circumcision, the research shows that removal of foreskin reduces the sensitivity of penis, since foreskin is made up of mucous membrane, frenulum and specialized nerves that can detect light touch, such as nerves found on our lips. So, is circumcision recommended or not?
So I was talking to you about circumcision, but you have to understand as to why people need to get a circumcision done. Now I already told you that one of the more common reasons why men come to us for circumcision is basically for a condition known as fasciitis. That is when there is an infection of the glans as well as the prepuce. Now apart from that, a lot of indications why circumcision can be done. Now one of the more important reasons is that for personal hygiene. Now a lot of studies have proven, the bacterial load on the foreskin and on the glans comes down for circumcision is done. So that is a very, very key reason. The second reason could be circumcision prevents the spread of sexually transmitted infections. Now it can, to a certain extent prevent the spread of syphilis, herpes, penile cancers, and there have been various studies on the prevention of spread of HIV as well. Now the third important reason for circumcision would be to prolong the duration of sex. We all know that the foreskin is a very, very sensitive part of the penis, and removal of the foreskin can actually kind of numb the penis a little bit, which involves in or rather translates to the delay in ejaculation. So men actually come and tell us that they want to prolong their time to ejaculation, which is why they go in for circumcision.
Recent research shows that circumcision can reduce the risk of penile cancer and infections such as gonorrhea, syphilis, and herpes. How circumcision helps in preventing STI. A study shows that 1 year after circumcision, males ended up with 81% less bacteria. With uncircumcised men, the foreskin is prone to infections because of the bacteria overload. Penile inflammatory skin conditions such as balanitis is the most common penile disease, especially in uncircumcised males. Inflammation of penile tissue at the glands is caused by the growth of yeast under the foreskin. Symptoms of inflammatory penile conditions include itching, swelling, tenderness, and pain. Another study with couples where female partner is HIV positive showed that none of circumcised men received HIV over 30 months, and 40 out of 137 men that were not circumcised ended up developing HIV. Since the most sensitive part of circumcised penis is not as sensitive as foreskin, the reduced sensitivity during sex could allow men to last longer during sex, satisfying the partner much more. Circumcision helps in curing premature ejaculation. While studying before and after circumcision, a study shows that 47% of men who experienced premature ejaculation found that the ejaculation time increased after circumcision and partner satisfaction increased as well.
So circumcision involves removal of the foreskin. It is usually a little painful because obviously any surgical procedure should be painful, but the trick is to make it painless, or rather as painless as possible. Now if you look at the traditional procedures that have been done, people either use the knife or they have been using the scissors and then later putting sutures. Most of these procedures involve sutures. Now there are some clamps, and there is also a technique known as the prepex. These are things that do not involve sutures, but still they're all going out, and then the laser came. And people said okay, the laser is very painless, but you have to understand, definitely there is cutting which takes time with the laser, and the sealing with the laser is not as great as other procedures, and also at the end of the procedure you have to suture it. Now at the Metromale clinic, we've been through all these procedures and we finally found out that the stapler technique is probably the best. So what we do is something known as the circumcision stapler. Now this is the circumcision stapler that I'm showing it to you. This is a disposable device. I do it once and then I throw it away. The procedure can be done under either local block, or it can be done under regional, or with a little bit of sedation anesthesia. Now you see this beautiful instrument, the stapler, and when I engage the arms of the stapler, you actually see the blade coming out, and you see the rim of this has a lot of staples. Right now this is a used instrument, so you can't see the staples, but you know where the staples are. And so when I apply it, it just goes in, and in a fraction of a second it just cuts and then seals the whole thing with the staples. Now the staples actually fall off in about 3 weeks, and you're able to resume sexual activity in a month's time. The best part of this stapler circumcision is that there is absolutely no pain. It is a very, very relatively painless procedure.
At the end of the day, circumcision makes it easier to keep the end of the penis clean and hygienic, and prevents infections and swelling diseases. Also, you shall prefer it if long-lasting sex is all that you seek. Latest advancements in non-invasive procedures such as stapler circumcision have made adult male circumcision accessible to all men with a reason.